foot has 26 bones in it and hundreds of tendons, ligaments, and muscles. And the foot is designed to be the support system of our whole body, right? It's designed to grip the ground, move, and our brain proprioceptively gets a lot of feedback from our foot. However, a lot of times the way we treat the foot in terms of footwear is if we treated our hand like this, I think you'd think I was crazy. So if you took your hand and you wrapped it really tight with tape, right? And then you put a cushion in there and you were like, I don't want the cushion's going to help a little bit. That's kind of how we treat the foot. A lot of people wear really narrow shoes and they tie them really, really tight. And they go, well, why isn't my foot supposed to be supported? It is, because we're not supposed to walk around on concrete all day long. But my argument is that, and from my experience, we wear shoes that are on the other end of the spectrum. They're too supported. So there's two factors that I look into when I'm looking at someone that has plantar fasciitis. One being, and I'll show you this, one being the width of the toe box. Okay. Right? So most shoes are going to have pretty narrow at the forefoot into the toe. So that's the first step, is a wide toe box. Have you ever looked at a footprint of an infant or a baby?
Not outside of the little one we do for like the ornament to give like the grandparents and stuff.
Next time you see one of those, look at it. The widest part of the foot is the toes. It's not the midfoot. What happens is when you wear shoes that narrow as you go down, you've seen people with those bunions and their toes are all, boom, they're jammed together. You ever seen a picture of LeBron James' foot? That's a weird question to ask another guy.
No, I haven't actually.
Look at that on Google.
Really?
Yeah.
Is it going to give me nightmares or?
So his big toe is over his second toe, and his pinky toe it looks like it comes to a triangle because these guys wear basketball shoes. Are you an NBA guy?
More 90s NBA guy. Not
Did you see what happened Sunday night in the Game 7 of the finals?
No, I didn't.
So I don't watch the NBA, but I saw this all over my feed. There has been so I got my shoe off here. There has been in the past 10 years, the NFL and NBA has seen a double occurrence of Achilles tendon rupture in sports. And I talked to you about why I think the wide toe box is important. There's a second thing that's important on these that I think has to do with that. And that's the fact that it is a zero drop, meaning the toe and the heel is at the same height. Most shoes that we wear have some sort of millimeter lift to them, right? If you think about a high heel, it's a pretty easy explanation. The heel is 2, 3, 4 inches, right? That would be a heel drop of 4 inches.
Right.
Most shoes, Hoka's, Adidas, Nike's, On Clouds, they're anywhere from 4 to 12 millimeters. It's nothing. Over time, it shortens all that tissue, right? So if you think about a lady in a high heel, the calf is shortened, the Achilles tendon is shortened, the plantar fascia is shortened. So why I like putting patients in a zero drop shoe. Now at the beginning, it's stretching all that. When they first put the shoe on, it's stretching all of that. So they're like, oh, I don't know if I like this. Once their foot gets used to that, it actually puts all of that structure at the right length. Going back to the NBA analogy, there's no evidence on this. I literally looked this up all Sunday night. There's no evidence that this is the case. But for me, physiologically, it makes sense. If you take all that tissue and you shorten it, and then you put an extreme load through that at its lengthened position, it's going to be compromised. Literally, the stats have doubled in professional sports in the past 10 years.
Really?
And what other reason that I can't think of any other reason of why this would happen? What is your thoughts on this?
Yeah, that's interesting. With a plantar fasciitis in particular, I'll usually recommend some kind of at least cork insole. I usually say like a Birkenstock or something that's pretty stable and solid. And that doesn't help everybody though. So I'd certainly be open to. I don't really know a lot of preventative measures for plantar fasciitis.
The thing about plantar fasciitis is not only is it shortened, but it's also weak. And that's where most patients go wrong, is they are stretching. That's half the equation. The other half of the equation is strengthening. That's another reason these shoes are good, is because they're wide and your foot is actually kind of sloppy in them a little bit. And you're like, these feel like my foot's moving around and I have to work. Because they do, right? Okay. So going back to the analogy of the hand, if I tape my hand up, what's going to happen to all like your patient that was in the brace that had to go to the therapist? Put them in the brace, all of that tissue becomes sort of immobile and it's got adhesions and it doesn't work the way it should. That's how it is with our foot when we wear conventional footwear. It's not 1 year of wearing this. It's 3 decades of wearing this. And over time, this happens.
And I wonder what the impact even is with footwear on like back pain, for example.
Oh, 100%.
Because it all kind of leads up to that area. I can remember I got a new pair of shoes after my first daughter was born. And I don't know if it's because they were new insoles or what, but like I didn't have any like back pain for like a couple months.
Sure.
You know? And I don't know, and I probably should know more about this or read more into this, but like how does footwear impact not just the pain in the distal extremities, but also in the whole body?
Exactly.
You know?
And how a heel drop can actually influence lower back pain, I'm actually really familiar with this because I've done a lot of research on it. If you take this, and once you see somebody that has a massive like Nike Shock shoe, it's like, it'll ruin you forever. Because I was at the gas station 2 days ago and I watched this guy walk out with these huge, thick heeled shoes, not the toe, just the heel. And I'm thinking, this guy has to have foot pain. He has to, wearing those type of shoes. But how it influences back pain is when you take the foot and you elevate the heel ever so slightly, it puts a slight bend in the knee and it puts anterior pelvic tilt. And I don't know.
What does that mean, I guess? I mean, just
anterior pelvic tilt?
Yeah.
So that is the classic, we call it lower cross syndrome or anterior pelvic tilt. So it's when your pelvis tips forward. Think about when you have a pregnant patient. I don't know how many pregnant patients you work on, but pregnant patient pelvis tips because you've got all that weight out front of you. You got some guy that's with a huge beer belly, right? So it tips where it's sort of, they're poking their butt out and they're pouching their stomach out.
Okay.
What that does is it compresses the facets and it actually closes down the intervertebral foramen because of that hyperlordosis. It's also very common with sitting a lot because if you think about the psoas and the hip flexor, shorten all day long, we go to stand up. What that does to the pelvis is it rotates it forward because it inserts inserts on the front of the hip there.
Gotcha. Okay.
Can pull the lumbar spine into hyperlordosis, which for a lot of people is going to cause facet compression and it's going to cause IVF stenosis, just real estate wise.
Right.
We're not even talking about the nerves and the soft tissue that's supposed to be in there. It's just going to cause compression on it via the structure.
Right.
That's one thing I'm passionate about. And, I had lunch with somebody today and they said, we obviously know that you treat spine. What else do you treat? And I said, I've somehow inadvertently become like a foot guy. And it's not because I wanted to. And it's not even, I kind of hate feet, to be honest with you. I've become numb to working on them. But I was like, I've sort of found this niche that was, I felt like a lot of patients were falling into where they'd been to the foot doctor, they had done XYZ, and they sort of were like in this cog, right? And they always were like, well, I'm just going to softer and softer and softer and softer shoes, which feels good temporarily because it's cushiony, but it actually makes the foot weaker.
Progressively weaker
over time. So you take that shortened tissue and you progressively make it weaker, and that's where you get your plantar fasciitis. So stretching it is a good step. I'm on board with that. Strengthening is another step. So footwear is going to be big. Being barefoot as much as you can is going to be big. And there's a plethora of exercises you can do. One that I like is if you take a normal kitchen towel, throw it flat on the floor. Envision this. You've got your heel off of the kitchen towel and you have your toes barefoot on the kitchen towel and you're taking it and you're flexed, scrunching it underneath the arch of your foot. Quite literally doing this with your foot. That will help to strengthen all of those plantar fascia muscles on the bottom of the foot. Those two, with the change in footwear, I'll do a little bit of manual therapy on the bottom of the foot up to the Achilles tendon into the calf. 4 visits, they're looking at me saying 90%. That is 90% of people.
Wow. Just kind of waking them up almost, it sounds like.
100%.
Okay.
And I think if they did the footwear change alone, I think I could probably help 40% of patients without even putting my hands on them.
Wow.
It's that impactful.
That important. Yeah. And I feel like there's not a lot of education surrounding that. I mean, I don't know a lot about podiatry. We do see some patients from them in terms of like CRPS that happens after surgery and things like that. But I do feel like I often see when they come in, it's more insoles. It's, get a foam in there, get a different orthotic shoe and kind of support.
And I never once blame a doctor for what they do, because they were educated in a different place and a different time, and we have different resources, right? So I'm never gonna be like, this is ridiculous that they're doing this.
No, I'm uneducated on it.
Yeah, it's you know what I mean. A lot of foot doctors are going to go with softer shoes that are, tie them tighter and let's put a big cushy insole in there. And I think it doesn't normally help. And like I said, this place is Texas Spine Center. This isn't Texas Foot Center by any means. But I've treated enough and I've seen enough where I'm like, it's just turned the light bulbs on. This is not something I learned in school.
Yeah.
This is something I've put together. And to me, it was the reason I dove into this sort of footwear is because when I was fresh out of school, I was wearing like some Adidas that I'd always worn. And after 12 hours of working on my feet, I was like, my feet hurt. Like my big toe hurt from kind of being jammed in. And I had a different pair of shoes that I worked out in that were sort of wider toe box. I had no idea what that meant, but just by the design, they were a little bit wider. And I started wearing those to work. And I'm like, I'm going to try to find a pair of shoes that's wider and has like room for my toes. And then that led me to a brand called Ultra. I've been recommending Ultra for years. These are a new different company called Flux that I just got into. Same concept, just different design, different company. But I'm excited to see how these do. But
I should probably get some of those because I'm not very good on the footwear side. I kind of just get the Berkeys and I get like the Asics on sale, and I know I have wide feet, and Asics are notoriously narrow.
They are.
30% off. I'm like, all right, great, but there's probably some downstream consequences to because I have wide front feet too, so I'm gonna have to look into
two
those.
things you should never skimp on. One is a shoe, another is a mattress.
I thought we were gonna say pillow, but yeah,